Hello everyone, I am Gayatri, an optometrist currently pursuing my fellowship in contact lens under Indian Academy. Today we will be discussing about how to do hand washing before handling a contact lens, a taco test to check for the orientation of a contact lens, insertion, removal and fit assessment of a soft contact lens. Always do initial slit lamp examination to ensure that the ocular surfaces are in a healthy state. Let's get started with hand washing. Hand washing is a crucial step to be done before inserting and removing a contact lens to prevent your eyes from getting infected. It should be done at least for 20 seconds. Dry it with a tissue paper or a lint-free towel. Soft contact lenses will usually be stored in a blister packs. Always check for the power and parameters before opening the seal. Open the seal. Take out the lens and place it in the tip of your finger and check for any defects and deposits. As there is no defects, let's proceed with the cleaning of a contact lens. Place the lens in your palm and pour the cleaning solution. Rotate the contact lens in a circulatory motion. Secure the contact lens on one side and clean the excess solution with a tissue paper. Now, let us do taco test to check for the orientation of a contact lens. Place the lens at the tip of your finger and check for the edges of the contact lens. It should curve inwards to form a cup shape, or else if the lenses are turned inside out, then the edges would curve outwards. In that case, we have to turn the lens and make it oriented. Place the lens exactly as shown in the video. Fold and release your fingers and check for the edges of the contact lens curling inwards. That means that the contact lens is in a correct position and not inside out. Another technique is to hold the lens in between thumb and index finger and to squeeze the lens. Observe the edges that it curves inwards, meaning it is in a correct position. Now the lens is ready for insertion. For insertion, stand to the side of a patient, place the lens on the tip of a dry index finger, instruct the patient to look straight, pull the lower lid margin down with the middle finger of a hand holding the lens. Now, instruct the patient to look down, lift the upper lid with the thumb of the other hand and place the lens. Slowly release the lower lid first and then the upper lid so that the lens is not displaced by the force of the upper lid. By asking the patient to look straight again. Minimal discomfort will be experienced by the patient in the initial fit. It will usually be settled down with the adaptation time of about 5 to 10 minutes. Given the adaptation time, let us proceed with the fit assessment of a soft contact lens. Ask the patient about the comfort. Now, by holding the lids apart, check for any conjunctival ingestion sign. Here, as you can see, the conjunctiva is clear. It indicates an ideal fit. Now, Let us proceed the lens assessment under a slit lamp with a diffuse illumination. Corneal coverage. With the eye in primary position, the lens should show full corneal coverage about 1 to 2 mm beyond the limbus before, after and during the blink. Lens centration. The lens should be reasonably centered, extending equal distance beyond limbus in all directions. Check for the lens centration in all positions of gaze by asking the patient to look up, down, nasal and temporal. As the lens is centered in all positions of gaze, it means an ideal fit. Lens movement. The movement of lens is essential for proper tear exchange and removal of debris. The patient is asked to look straight in the primary gaze and asked to blink normally. 0.2 to 0.4 mm movement is an ideal movement for thin lenses. For push-up test, the patient is asked to look straight and the examiner pushes the lens up vertically through the pressure on the lower lid. An ideal fitting lens will displace easily and return smoothly. To check for the lens Leagan upgaze, the patient is asked to look up and the lens will move down slightly. Edge alignment. The edge of the lens should be observed with reference to the conjunctiva. If the edge is sliding smoothly and aligning with the conjunctiva, it is a desired result. As the lens is found to be an ideal fit, let us check for the patient's distance and near vision acuity. For removal, pull down the lower lid margin with the help of a middle finger of one hand. Ask the patient to look nasally. Lift the upper lid with the help of a thumb of the other hand. Touch the lens with the index finger of the hand that is retracting the bottom lid and slide the lens onto the temporal sclera. While still holding the lids apart, pinch the lens gently with the thumb and the index finger and remove the lens. Alternate technique. Hold the lids as mentioned earlier. Ask the patient to look up and with the help of an index finger, slide the lens down. As soon as the lens is halfway off the cornea, pinch the lens with the thumb and index finger and remove the lens. After removal, the lenses will be discarded if it's a daily disposable lens, or else place the lens in the palm, pour the solution, clean the lens in a circulatory motion, and then store it in a sterile lens case with a fresh solution. Follow these steps for a better and safe vision